Hello ladies and gentlemen, boys and girls, welcome to my YouTube channel. Yet again, a new video on classification of drugs. Your presenter here, IDE Henry, here to take you through classification of drugs. So let's quickly dive into it. What is a drug, ladies and gentlemen? What is a drug? Are you a student who's taking pharmacology and you're finding it hard to study this course? Well, let's make it simpler for you. So, a drug is a chemical substance of known structure which is used in the diagnosis, cure, and prevention of diseases. A drug is a chemical substance known with a known structure which is used in the diagnosis and cure and prevention of diseases. Okay, how are drugs classified? So drugs are classified in the following ways. Drugs are classified according to the chemical properties that they possess. They are classified according to types of disease-causing organisms they target and their mode of action. So let's quickly dive into the first class of drugs, which is analgesics. What is this class? Also known as painkillers. So analgesics are drugs that are used to relieve pain. These drugs are classified according to the way they act to elicit an effect in the body. So analgesics are classified in three groups. We have non-opioids, opioids, and co-analgesics, ladies and gentlemen. Okay, so what are opioid analgesics? Opioid analgesics are also referred to as narcotics. So opioid analgesics are drugs that relieve moderate to severe pain, and these are drugs that cause numbness and induce a state of unconsciousness. Alright? They have a tendency to cause tolerance and dependency as they have no analgesic ceiling. Some narcotics, though, in the same class are more potent than others. By that we mean some narcotic drugs are more stronger than others. Okay, so quickly, opioid analgesics. What are the properties? So some of the opioid analgesics are of the following examples. We have morphine, codeine, and pethidine. Okay, what are properties of opioid analgesics? The properties are as follows. They act centrally, meaning they affect the central nervous system. They cause addiction and dependency. They cause sedation and respiratory distress. And they have no anti-inflammatory effects, okay? These increase in dopamine. The increase in dopamine causes the intense feeling of happiness and pleasure. So they cause super excitement, also known as euphoria. They also cause they may cause respiratory distress, and also they are classified in schedule number 2 and 3 under the Controlled Drug Act classification. Okay, then how do opioid analgesics act to stop pain? How do opioid analgesics act to stop pain? These opioid analgesics act on the brain by activating opioid receptors. So these receptors reduce the neuronal excitability in the pain-carrying pathway by activating these receptors, thereby increasing the release of neurotransmitter dopamine. Okay. Furthermore, the opioid analgesics act on the brain by interfering with the transmission of pain impulses in the brain. They increase in dopamine, causing the intense feeling of happiness and pleasure, which is known as euphoria, and that people feel when they use these drugs. Okay, what is the mode of action of opioid analgesias? So these opioid analgesias also suppress the cough reflex by direct acting on the cough center in the medulla and reduce motility of gastrointestinal tract. That is why we have Benylin codeine cough syrup. It depresses the respiratory center, specifically the cough center, hence relieving cough. Okay, what are the properties of opioid analgesics? Some of the properties of opioid analgesics include but are not limited to short-term effects such as drowsiness, itching, sweating, pupil dilatation, and visual problems. Also, nausea and vomiting, lack of concentration, constipation, anxiety, slowed breathing and fatigue, and decreased appetite. What are the long-term side effects of these opioids? They cause depression, insomnia, respiratory depression, decreased concentration, and decreased pain threshold. Okay, now we talk about the non-opioids, also known as the non-narcotic analgesics. These drugs relieve pain without causing loss of consciousness, unlike the opioid analgesia. They are also called non-narcotics, and they have three chemical properties. Principally, they are analgesic, meaning they relieve pain. They are antipyretic, meaning they reduce body temperature when raised. And they are anti-inflammatory, meaning they relieve inflammation. Okay, some of the examples of these non-opioids include paracetamol, also known as Panadol, acetylsalicylic acid, also known as aspirin, diclofenac, ibuprofen, and indomethacin. These are some of the examples, ladies and gentlemen. What are the properties of non-opioid analgesia? They act peripherally, and they do not cause dependency. They are not controlled drugs, meaning they are not under any act. Most side effects are gastric irritation, bleeding problems, and they possess an anti-inflammatory effect. Okay, they are used in the treatment of mild to moderate pain, while the opioid analgesia are used in moderate to severe pain. They act primarily on peripheral tissue by inhibiting the formation of pain-producing substances such as prostaglandin. So non-opioid analgesia do not bind to opioid receptors, meaning they do not relieve pain that is so severe. Furthermore, the non-opioid analgesia act by, this is now the mode of action, the non-opioid analgesia act by they inhibit the production of prostaglandin, which are chemical mediators responsible for initiation of pain transduction. Okay, this is achieved by inhibiting the action of an enzyme called cyclooxygenase or COX enzyme, which converts the arachidonic acid into prostaglandins and other related substances. Okay, thank you very much for watching my video. This is part 1. In my next video, see you when we're going to be talking about antibiotics. Don't forget to like and subscribe. Drop a comment in the comment section if you want me to drop a video on any particular topic in nursing. Until then, see you next time, ladies and gentlemen. This marks the end of my presentation.